We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into Mon Health Talk. I'm Dave Wilson. Our guest this morning, Dr. Karim Ibrahim, Mon Health Primary Care, Westover Gateway. We'll be talking about primary care this morning, but let's first welcome in Dr. Ibrahim. Good morning, sir.
Hi, good morning.
Hey, thanks for taking a few minutes with us. We'll get into talking about primary care and what's going on there with Mon Health, Westover and Gateway. But first, we like to welcome you to the show, and we always make our guests talk about them at least for a minute or two. So let's learn a little bit more about your background. Tell us where you're from, where you went to school. How did you end up with Mon Health?
Sure. Yeah, I mean, it was a bit of a long journey, but it all started in the Middle East. So I'm Egyptian. I grew up in the Middle East. I spent the majority of my life in Kuwait. And then I went off to medical school at the Royal College of Surgeons. After that, I did a internship in the Middle East at the King Hamad University Hospital before I moved to Texas. I worked in a pharmaceutical company as a research coordinator for about a year. After that year, I went on to do my master's in the education of healthcare professionals at Johns Hopkins University. Once I finished the master's, I moved on to residency. I did residency at Cornerstone Care in Mount Morris, Pennsylvania. I joined the psychiatry track at the Cornerstone residency program, where they have a longitudinal psychiatry training while you get your family medicine training. Then I served as chief resident for my final year before joining Mon Health.
You aren't lying. That is quite the journey from Egypt, the Middle East, to Texas, and now here you are here in Morgantown and Montague County. We could probably do the next half hour just talking about your travels and what you've seen, what you've done over the last several years, couldn't we?
Yeah, I guess so.
So you, what's your specialty and what led you to it?
So I'm a general family medicine outpatient doctor. I'm interested in psychiatry, men's health, and obesity medicine. Other than that, really, it's just the normal bread and butter family medicine, which I enjoy. I love it.
Why do you love it so much? What drew you to, being a general practitioner and dealing with family medicine?
I like the variety in family medicine. Out of all the specialties out there in medicine, family medicine is the only specialty that actually can take care of all different ages, from the day you're born till the day you pass. Your family doctor is there from day one. So I like that. I like forming the strong relationships with the patients. Sometimes it's easy, sometimes it's hard, but I enjoy that. I enjoy the variety. I never really wanted to just stick to one kind of organ system or pathology in our body. I kind of like treating the patient as a whole, whether it was just as simple as your high blood pressure or it's going through pregnancy or dealing with anxiety and depression. I like being able to have that variety in my day.
Our guest this morning is Dr. Karim Ibrahim, Mon Health Primary Care, Westover Gateway. And here's the question that's kind of the foundation for, I guess, the rest of the show. Why is having a primary care physician, having that family doctor, so important to really your overall health?
Yeah, I mean, a lot of people don't have a family doctor until they kind of get sick, which, I mean, it makes sense. I understand how people kind of don't want to go to the doctor's office, don't want to find out problems and start worrying about their health. My recommendation is get a family doctor as soon as possible. Even if you're feeling healthy, just establish with someone. So God forbid, somewhere down the line, if you do need your family doctor, you're already established. You found someone that you're comfortable with. You're willing to ask them good questions. And it's kind of just a good way to make sure you check off all the boxes in your health so you can live a long, healthy life. It's scary at first, and making that decision to call a clinic, make an appointment is a little bit overwhelming for some people, but really just come on into the clinic, sit with your family doctor, let them talk about your health and what you can do to make yourself feel better and just not miss anything important.
And you already talked about this, the family physician could be with you from birth and right up to the very end, I suppose, if you guys have that relationship that long. But what advantage is there to developing that relationship with the patient and seeing the patient year after year after year? What advantage is that for you?
So, I mean, every patient is different. Everyone has their own concerns. Everyone has kind of different goals on what they want to achieve out of their health. It's knowing someone for several years and treating their health for several years is actually the best way, in my opinion, to manage a person's health, is kind of knowing them for several years and knowing all small little problems and issues that they face, so you can kind of formulate a plan for the long run. I mean, a lot of family doctors end up getting to know someone when they're coming in sick and they have several problems they kind of want to address, and that's when the relationship kind of starts. It's still a lot easier to just come in before a lot of things start to pile up. So the stronger the relationship, the better the outcome most of the time.
Dr. Karim Ibrahim is our guest this morning, Mon Health Primary Care, Westover and Gateway. We'll continue our conversation right after this. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Dr. Karim Ibrahim, Mon Health Primary Care, and we're talking about, obviously, primary care this morning. Dr. Ibrahim, you mentioned your background in psychology and some mental health. How does mental health play into our overall physical health?
Yeah, I mean, a lot of people think of your mental health as just feeling sad or depressed or feeling anxious. A lot of people tend to forget that it actually has a lot more than just those mood symptoms. A lot of people with depression, for example, can experience a lot of agitation and irritability. They tend to have a poor concentration throughout the day. They aren't sleeping well. They aren't eating well. And it's all those factors that kind of interfere with the day-to-day functioning. It really doesn't become a mental illness until it interferes with their functionality throughout the day. It's a real condition with real diagnoses and treatment that unfortunately goes very unappreciated, or just a lot of people are walking around out there with depression and anxiety, which is unfortunate, and the treatments have been around for years, and it's just getting people more aware of what they're feeling and how they're feeling. That's kind of before it becomes serious.
This goes back to what we talked about earlier, that relationship you build with the patient. And if you see a patient, year after year, or maybe even more often than that, does that help you to notice maybe subtle changes in behavior, subtle changes in attitude that might be an indicator there are some might be mental health issues to ask about or address?
Sure, yeah. I mean, once you know someone for a long time, you can kind of tell if something is going on or not. I personally like to ask at every appointment how their mood is, because even if they do appear to be happy or doing well, sometimes when you ask that question, they sit down and think about it and they say, well, no, actually I've had some couple bad days, and they kind of start the conversation. So, I mean, I encourage everyone to have this conversation with their family doctor. If you are feeling depressed or anxious, bring that up with your family doctor. A lot of medications are available. A lot of them do work, and it's something family doctors are very well trained at and can help you out with.
We've heard a lot of talk about mental health in media, and it seems like people are more willing to have those conversations. Are you seeing that as a physician, patients more willing to open up and talk about that?
It depends. It depends on the patient and their personality. Some of them are more willing to talk about it. Some of them aren't. The difference between men and women as well too is, I mean, a lot more men tend to keep it deep down and hidden, and they won't bring it up unless they're asked. It's sometimes we're chasing reasons why they're tired, and we kind of do a full medical workup and nothing comes out of it, and we come to the conclusion that it likely is their depression that could be contributing to them being tired. So it really does depend from patient to patient whether they'll have the conversation with you or not. Not everyone's comfortable with that, opening that conversation.
Our guest this morning, Dr. Karim Ibrahim. He's Mon Health Primary Care, and we'll turn the focus on us guys on the other side of this break. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Our guest this morning is Dr. Karim Ibrahim, Mon Health Primary Care, Westover and Gateway. Dr. Ibrahim, what are some of the top health concerns for us guys specifically?
The one that I tend to get the most in my clinic is testosterone and prostate cancer screening. I'll start off with prostate cancer because it's definitely a hot topic and a question for a lot of guys out there. When it comes to screening for prostate cancer, there has been a lot of confusion whether we should screen or not. A lot of the recommendations suggest that we should start screening at the age of 55 to the age of 69 after we kind of had a discussion about your risk factors for prostate cancer. I personally think that's a good idea just to get the test done. It's a blood test where we check your PSA or prostate-specific antigen. A lot of subspecialties will test that maybe once a year, maybe twice, depending on their family history and their genetics. I think it would be a good idea maybe to get a number every year or two. We kind of put those numbers together, the PSA numbers, and we look at the velocity or just the rate of it rising. And if it's in a concerning range, then definitely we'll send you to a specialist to get further testing. Does everyone need prostate cancer screening? Probably not. I just don't think there's any harm in getting it done. A lot of men think that the physical exam is the only way to check for prostate cancer. It's not. We are kind of leaning towards blood tests. And obviously the best way to do it is to do a physical exam and a blood test as well. It's not as scary as the other cancers out there. All cancers are scary. There is ways that we can treat it, especially if we catch it early. So I do recommend to have this conversation with your family doctor and see if prostate cancer screening is a good idea for you or not.
You know, I have friends. I have a friend, a pretty close friend actually, who was just doing the annual checkup. Dr. Ibrahim got his blood work and his. I know this is a very technical term. The numbers were out of whack a little bit, and that led to a follow-up appointment, and they caught it, prostate cancer, caught it very early, were able to take care of it with minimal problems. Let me put it that way. But it was because those numbers showed up and indicated something was a little bit off, and they were able to find it very, very early in the process. Had it not been for that number, who knows?
Absolutely. I mean, yeah, I wish everyone has a story like your friend. It's available. It's an easy test. It's not expensive at all. It's part of our kind of a routine panel that we do. So yeah, go in, get it tested once a year. If you wanted once every 2 years, that's fine too.
We got just a couple of minutes left, and we can probably do an entire show when it comes to obesity, especially here in West Virginia. We do talk about it often, But broadly speaking, how does being overweight and obese, grossly overweight, how does that impact your overall health?
Okay, so obesity will carry problems, whether it's mechanical, just from the weight on the joints, for example, like on our knees and our back. Definitely, there is known problems that come from obesity when it comes to just your knees and your back. Putting all that stress on those joints will definitely cause you a lot of pain and maybe even lead to a surgery down the line. Then there's the hormonal or more metabolical problems that come with obesity. Another thing that kind of popped up recently in the literature is the link of obesity with certain cancers. One of the most known cancers probably that's related to obesity is a postmenopausal breast cancer. So because of the hormonal imbalances that happen with obesity, they have a higher risk of breast cancer in the menopausal state. Colon cancer is actually very common when it comes to men related to their obesity and the poor diet. So it carries so many problems. I mean, a lot of the problems we see in family medicine relate to the high blood pressure, high cholesterol, even reflux or diabetes. Diabetes is a huge problem related to obesity. We all know this, and it's just that there's so many advances that have come into the world of diabetes and obesity medicine. There's just so many good options out there. Obviously, every individual is different. Some will benefit more from bariatric surgery than it will be from the medications. Some people just need that extra push or just a conversation with their family doctor. Hey, I don't know what to do about my obesity. I've tried diet and exercise and it just hasn't worked. There's so many good resources available here in Morgantown in West Virginia. It's just come to your doctor, have the conversation before your weight becomes a lot more difficult to treat. It's a huge problem. It's been around for a while. Thankfully, we have a little bit more tricks up our sleeves as family doctors now, though.